you have to be very mindful when you're helping somebody who's having dark or suicidal thoughts. It can be a challenge, and I think for family members and friends, it's most the challenge. It's the greatest challenge because you're not exactly sure what to do. You don't want to say the words. I think a lot of people are worried that they're going to say the wrong thing and they're going to cause the person to commit suicide. And I think that's often a big mistake. You know, if you're uncomfortable when you're talking to somebody who's suicidal, they're not going to feel safe to talk to you about it, and they're going to be uncomfortable talking about it. It's asking questions like, listen, do you actually want to be dead? Or are you saying that you want to stop feeling like this? Because often people will come in and say, Janna, I wish I was dead. And I'll ask them, okay, what do you mean with that statement? Well, I don't want to feel like this anymore. And the only way I can imagine not feeling like this anymore is to be dead. So they're not actually wanting to be dead. They're just so desperate that they don't want to feel like this anymore. So it's learning to differentiate some of these things. It's learning to talk about them. Sometimes it's separating that out. Sometimes it's just being very direct and talking to them about it. It's saying, look, obviously something in your life is very troubling. It's really bothering you. What is it that's going on? What's bothering you? What's your plan? Have you got a plan to kill yourself? Have you got the means to kill yourself? So we do a full check to make sure that, they're safe. Sometimes it means, we would send them off to the hospital and have them be in a safe place where they can be monitored. And sometimes we can handle it in office and we can talk to them and we can, contract with them so that they're okay. But with dark thoughts, with suicidal thoughts, I tend to be very direct with people. I think we have to be able to talk about suicide and not be afraid of it. These are real, genuine feelings that people have. They're real, genuine feelings that people have for a reason. They're not there for no reason at all. And they can be terrifying to the person who's having them, and they can be terrifying to the people around the person because you never want to see your loved one go through that.